Hey everyone, I'm Sarah Hornsby and I am your online myofunctional therapist. And today I want to talk about a topic that really comes up a lot for me in my everyday life when I'm practicing myofunctional therapy and working with patients, and that is building an airway team. And this doesn't seem like it should be hard, really, it shouldn't be. But the difficult thing is a lot of people who have myofunctional issues also have airway issues and orthodontic issues and many other things going on, maybe even pain, clenching, grinding, headaches, so much. There's so many things that can be intertwined into the treatment when it comes to myofunctional therapy. So I really see my role as a traffic director, and this is a challenging role because I'm constantly trying to find the doctors, find the dentists, find the ENTs and pediatricians and chiropractors who understand what I do and what I'm talking about. And more importantly, they understand how important the airway is and breathing. So finding a team is something that you can work towards on your own as a patient. If you need myofunctional therapy, it's not just about the therapist herself or himself, I guess. There's so much more than just finding the myofunctional therapist. And unfortunately, this makes it very challenging, and our modern healthcare system is really not set up for this team approach to care. And it's difficult, it really is. So the doctors that I can find who are looking at myofunctional therapy, they're looking at tongue ties, and they're looking at the airway and sleep apnea, they're kind of taking the hard road, honestly. They are saying to their patients, before I put braces on you, I think you need to have your tongue tie released, so you need to go see this surgeon. I think you need to do myofunctional therapy, so I think you need to go work with Sarah or someone like me. So they are basically giving their patients these other options and telling their patients that the treatment plan is so much bigger than just putting braces on. And I have a lot of respect for these doctors because those patients might not come back. They might feel overwhelmed. They might feel like this treatment is just too difficult. When I go to the dentist down the street, they didn't say anything about myofunctional therapy or that I'm tongue-tied. And they said I could finish my treatment, within the next 18 months and it would be easy. So finding the right doctors and building your team, finding people who aren't just giving you the treatment, but who are looking at the big picture can be incredibly helpful. And I think it's critical when it comes to addressing these myofunctional issues. So it's kind of the hard way, unfortunately, to look at the big picture. And like I said, our healthcare system isn't fully designed to do this. So it's hard to find these people. But I can assure you, the field is changing, knowledge is growing, we're getting more and more research. And every day I'm meeting more doctors, dentists, ENTs, hygienists, speech pathologists. I'm meeting more and more people who are interested in these topics and who are wanting to form their own networks. So no matter what city you live in, no matter what country you live in, the awareness is growing. So try to find those key providers and don't just think about the myofunctional therapy. Think about what else goes with that and how do I find the best providers to help me with these issues. I hope that makes sense. I know it can feel overwhelming when you have so many things to work on and so many things to treat, but it really is the best way. So if you can try to look at the big picture, especially for kids as they're growing, it really is, there's a lot to it. So it's not an easy thing, but it's a critical and necessary undertaking. So I encourage you, find that team, and I'm happy to help. If you have any questions, you can reach out to me. Post comments below, share this video, like it, and subscribe to my channel if you think this is helpful information. All right, thanks so much, you guys. I'll see you on my next video very soon.